Tips on how to prevent COVID-19 infection. Number 1. Practice hand hygiene and wash hands regularly. Keeping hands clean is one way to prevent spread of infection.
Using soap and water is recommended.
Wet your hands with clean, running water, warm or cold, and apply soap. Make sure to lather the backs of your hands, between fingers, and under nails. Scrub hands for at least 20 seconds and rinse under clean running water. Proceed to dry hands using clean towel or air dry them. Alcohol-based hand sanitizers with minimum 60% alcohol are a practical alternative when soap and water aren't available. When using hand sanitizer, apply it to the palm of one hand and rub the product all over the surfaces of your hands until your hands are dry. Note that hand sanitizers may not be as effective when hands are visibly greasy or dirty. Number 2. Maintain a safe distance from everyone whilst in public areas. The simple idea is to maintain a distance between yourself and others and minimize physical interactions. Keeping a safe distance can lower the spread of COVID-19. Maintain at least 1 meter distance between yourself and anyone who is sneezing and coughing. That's because when someone coughs or sneezes, they spray small liquid droplets from their nose or mouth which may contain the virus. Take social distancing seriously. Number 3. Practice good respiratory etiquette. Don't touch your eyes, nose or mouth. Keeping hands away from your face will help by cutting off possibility of infection by touching a contaminated surface and the transfer of virus to your face. These viruses can't penetrate the skin, it can only cause infection if it makes it to a mucosal membrane like our eyes, nose or mouth. Number 4. Practice sneezing or coughing etiquette. Use a tissue to cover your mouth and nose. Cough into your bent elbow if you don't have tissue. Never cough into hands or the open air and always turn your face away from people around you when coughing or sneezing. Throw used tissues in the trash immediately and wash your hands. Number 5. Stay home if you feel unwell. Unless an emergency, reduce your risk of catching or spreading illness by staying home if you feel sick, even though your symptoms are mild. Do not go to work, school or public places, and avoid public transportation. In the event that you have a fever, cough and difficulty breathing, seek immediate medical attention. It is a good idea to call your medical health care provider beforehand. Follow the directions of your local health authority. Number 6. Indoor ventilation is crucial. In closed rooms, the number of viruses in the air can increase dramatically. Therefore, regularly ventilating a room up to 3 to 4 times a day for 10 minutes counteracts this and will reduce the risk of infection. This also improves the indoor climate and prevents the mucous membranes of the mouth and nose from drying out. Number 7. Wearing a face mask helps. WHO advises that you only need to wear a mask if you are taking care of a person with COVID-19, or when you are coughing or sneezing. However, there is enough evidence to endorse the use of face masks for short periods of time when in higher risk situations, such as on crowded public transport or visiting busy areas. Wearing a face mask while out and about on busy public transport, and in other crowded places, could help protect people from COVID-19. Studies conclude that people who wore masks, usually surgical grade, were less likely to get respiratory symptoms from casual exposure in the community. It is worth noting that masks are only effective when used in combination with regular hand washing. Number 8. Discard used face masks and tissues immediately. Throw immediately into the trash, preferably into a container with a garbage bag that you can close tightly and dispose of regularly. Then immediately wash your hands. Number 9. Stop shaking hands, hugging and kissing people for now. Similarly, avoid touching other people. Skin-to-skin contact can pass the virus from one person to another. Number 10. Do not gather in groups and avoid socializing in crowded public places. Being in a group, gathering or crowd makes it more likely that you will be in close contact with people. There is a possibility the virus may be airborne from other people in the venue. Number 11. Clean communal surfaces frequently. Wipe down and disinfect touch points like fridge handles, light switches, door knobs and computer keyboards etc. Do this even if no one in your household is sick. This practice will prevent the virus to spread between humans in a shared environment. Use alcohol-based disinfectants to clean hard surfaces in your home. Disinfect areas after you bring groceries or packages into your home. Use white vinegar or hydrogen peroxide solutions for general cleaning. Number 12. Wash fresh groceries. Practice soaking all raw, whole fruits and vegetables in a solution of food-grade hydrogen peroxide or white vinegar. Dry them before putting them away in your fridge or cupboards. Alternatively, use vegetable antibacterial wash to clean produce. Wash your hands before and after handling fresh produce. Be vigilant. It is unlikely that the COVID-19 pandemic will go away soon. There are still many unanswered questions about these viruses. Scientists and experts all over the world are constantly discovering new facts about these particular coronavirus. At the same time, there also appear to be many more new questions.